Ashley Bloomfield is back with us. A very good morning to you.
Good morning.
I tell you what, the more I'm reading about Omicron, the more positive I am. What about you?
I'm keeping an open mind about Omicron. I think the big thing, though, and Mike Ryan at the WHO said this repeatedly, our problem is Delta, not Omicron. And let's keep focused on getting on top of Delta. And that will serve us well for whatever Omicron brings along. But we'll just keep an open mind and see what the next couple of weeks bring.
But all we know so far, it's mild. There are no deaths. There are no hospitalisations. If it spreads faster than Delta, it solves the Delta problem by itself, doesn't it, to a degree?
Oh, I'm not too sure about that. I think that's a pretty optimistic view of it. We don't know for sure if the symptoms and the impact is mild. We just don't really have enough information as yet. But we will be looking at that. We will clearly be looking at transmissibility and also the vaccine effectiveness. Those are the three big things. A couple of weeks' time, we'll know a lot more than we know now.
Haven't had you on since you gave the Cabinet that all the information came out that you gave Cabinet Level 4 and Level 1 advice and they ignored it. How often are you ignored and does it bother you?
I don't sort of keep a tally of how often my advice is taken or not, but what I would say is, my job with my team here is to give our very best advice, and Cabinet, of course, around the table has to weigh up, as any Cabinet does, a whole lot of different perspectives and issues and then come up with the best decisions. So, I stand by our advice and I think it's been influential in ensuring that New Zealand's done really well through the COVID-19 pandemic.
See, what I can't understand is when you say, let's hold it because I'm nervous, and they then weigh up all the stuff they weigh up, like the economy and closed doors and stuff. I get the conflict or the tension there. But when you're saying we can get out of level 4 now and we can go to level 1, that's to the benefit of literally everybody. And why would they argue against you on that?
Well, I don't think they're arguing against. I think that they
they didn't take your advice.
Well, they I'm sure took most of my advice on all those sort of level changes, and so it's always a big decision, and I think I've said that before. Every time you give advice about a level change, whether that's up or down, it's a big call, and it's hard to know. We live life forward, but we understand it looking backwards. So I'm pretty happy with the advice we've given, and so far the decisions I think have served us well.
The headline that's been drummed up this morning is rural hospitals and doctors a bit worried about when we all go on holiday and all get COVID and die. Should we be worried in the rural parts of this country, or will they cope?
Well, I don't think we should be any more or less worried than we might usually be. New Zealanders do travel out to the regions every year in summer. We did it last summer. We've been working with all the district health boards, and indeed I've spoken directly with the rural hospitals and rural doctors network about what support they might need. And all the district health boards are ensuring that services are available, not just if there are any COVID needs, but of course for other healthcare needs over the summer break.
As regards kids, the young kids, the primary school kids getting jabbed as of January, do you worry that there isn't really a period of time where they can get jab 1, jab 2 before they go back to school? This will be in the school year. Is that a problem or not?
I don't think it is a problem for two reasons. First of all, where we really want to have our children and our high population protection is going into winter next year. It's a big seasonal difference, and we can see the difference, the impact that's having over there in Europe. I think the second thing is, and I made this point yesterday, actually most of our cases in children have not happened through transmission in school settings, they've happened in households. And, so the best protection for children is actually adults and others in households getting vaccinated themselves in the meantime. As
regards this red light system or orange light system that we're going into tomorrow, so Auckland's going into example 4 red, but I'm looking at the numbers yesterday. Once again, they hover around 140, 150, 160, something like that. Hospitals aren't stretched. This thing looks to be, because of the high vax rate, broadly speaking, under control. Is that fair?
I think that's very fair, and it's the point I've been making. Actually, the vaccination rate in Auckland is having a real impact, and even nationwide now, we're up to 93% first dose with another percent of people booked, so we haven't stopped at 90. We are seeing an impact, and it's great to see Auckland has numbers have levelled off and probably, on the way down. Another couple of weeks there will give us a really strong signal about how well the outbreak is under control.
Good, glad you said that. So what is it we're looking for in the next 2 weeks? Is the initial red a purely political decision? Because right here, right now, I don't see why Auckland's in red.
It's not a political decision, and in fact, it reflects our advice and the advice of others that going into the new framework, go in with a little bit of caution, because it does involve Auckland opening up further. Hospitality, of course, opening up, which is great, and so go in cautiously. But then that was also why the PM signalled in a couple of weeks' time we'll review and see what the settings
and in reviewing in the 2 weeks, I can see if the numbers stay the same roughly, if the vaccination rate does nothing but go up, I can see no reason not to be in orange. Otherwise, I'm looking at your lineup of your orange, red and reasons for it, and it makes no sense.
Certainly things are heading in the right direction, and we'd want to keep that happening, wouldn't we? The signs are all good in Auckland, and I think it reflects some great work by the teams up there, and particularly that high vaccination rate is going to make a real difference.
Appreciate your time. Ashley Bloomfield with us this morning.